The trial has been presented here by Paolo Ghia from Milan. It's a randomized phase 3 trial in relapsed CLL, and the trial is comparing Acalabrutinib, which is also a BTK inhibitor as ibrutinib, but it's a little bit more specific against BTK, and Acalabrutinib is compared against investigator's choice, which is either bendamustine plus rituximab or adalimumab plus rituximab. So in this trial, most of the physicians have chosen adalimumab plus rituximab, and only 10 or 20% were treated with bendamustine rituximab. The primary endpoint is the progression-free survival, showing a highly significant superiority of the continuous treatment with Acalabrutinib. In the comparator arm with adalimumab plus rituximab, median progression-free survival was 19 months, which is comparable to prior trials because due to toxicities, many people stop at adalimumab treatment. When we look at the safety profile of Acalabrutinib, we see similar adverse events as we have seen with ibrutinib, but we are still waiting for head-to-head comparison. It looks like as if Acalabrutinib could induce lower rates of atrial fibrillation. This drug is also inducing atrial fibrillation, but the rate could be a little bit lower. Also bleeding, what we have seen could be a little bit lower. On the other hand, we also see neutropenias with Acalabrutinib. So we hope that this drug will be also approved in Europe and in the US. In the US, it's already approved for mantle cell lymphoma. And it would be good to have 2 BTK inhibitors available that we can switch for patients who do not tolerate ibrutinib, for example.